Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, I'm Louisa Medhurst. I'm 51, single but live with my partner in Leicestershire. I'm a former journalist but I've worked for myself as a freelance PR consultant for the past 10 years. Just live with John and my cat Sam. I was diagnosed with DCIS in March 2011 and went on to have a reconstruction.
So Louisa Medhurst is here, thanks for coming in, and I know you from previously.
That's right, yes.
And do you mind if I say for the viewers from the start that you've had a breast cancer diagnosis, initially DCIS?
That's right, yes.
And we'll talk a little bit about that. Let me ask you at the start, were you well prior to the diagnosis? Were you well in yourself?
Yes. I'd had an unrelated problem with my hip, but my general health was pretty good, yes. Yeah. I had no reason to suspect that anything was wrong, so it all came as a surprise.
What was the first sign then?
The first sign actually was in September 2009. I had some slight bleeding from my right nipple, which I went and had checked out and was immediately referred to the Glenfield. Because I was for the late 40s at that time, it was deemed to be hormonal. So, and I was thoroughly checked out with a mammogram, ultrasound and a physical examination. And so I went away and everything seemed fine until about, the end of 2010, I noticed that there was some thickening in the right breast. Initially, I wasn't alarmed because by then I was 49. A few of my friends were having similar breast pain and we sort of thought, oh, well, it's puberty in reverse. So eventually I did go and see my GP. She wasn't alarmed initially, but she did say, because there is a difference between the right and the left breast, I would like you to go to the Glenfield and just have it looked at. If anything, just for your own peace of mind, which is what I did.
So after that point where you'd received that initial information, what was the next step?
The next step, I was within the 2 weeks, I had a letter to attend the Glenfield unit, an evening appointment. I think it was a backlog of GP referrals. John, my partner, was going to come with me, but I was so nonchalant about the whole, so complacent. I actually said, no, it's a nice evening, go and have a drink at the pub. So off I went, and I waited quite a lot, because there were quite a few people there. Eventually had another mammogram and an ultrasound, and it was only during the ultrasound the alarm bells rang, because I actually underwent a core needle biopsy and an axilla biopsy. And even, it sounds really dim, but even at that point I was texting John saying, oh, I'm at the back of the queue, I'm sure I'm wasting everybody's time. And I was seen last by one of the senior consultants. He asked me to talk through why I was there, so I explained it's my age, this thickening has appeared, and I'm putting it down to premenopausal symptoms. And he was very nice, examined me and said, yeah, that's all true, yes, you're right about that, but we found 4 suspicious lumps and we want you back on Monday with your partner, which was a bit wow. And I sort of knew by then, because there was a period of about 10 minutes while I was in the waiting room before seeing the consultant, and he came in with a breast care nurse. Now, I did hear them whispering, and I thought, this didn't happen in September. And I'd also been asked during the ultrasound, have you come on your own? And I actually said to the nurse, oh yeah, I'll be fine. Is it because I've got to drive when I've had the node biopsy? And she said, oh, no. So I think they were trying to sort of forewarn me, really, and whether I was in a little bit of denial, maybe. But my initial reaction, I didn't cry. I went a bit hyper. I remember as I left the clinic, I rang a friend of mine, a very close friend, whose mother had breast cancer. And this friend has always said that this is her destiny. Oh, I'm going to get that, Lou. And it sounds terribly cruel, but I rang her and said, Susie, I've got it, not you. But she was brilliant with me. She made me get into my car, she offered to come and be with me, but I said, no, I'm fine. And I sat in my car and put my head between my knees, because I think I was hyperventilating. And I managed to drive home, which is only half an hour journey. And the worst thing was going home and having to tell John. That was awful. And he knew the minute I walked in that it hadn't gone well.
Would you have preferred, really, if he'd gone with you in retrospect?
I don't think I would. I think it gave me time to compute the information. Also, someone else very dear to me had breast cancer when she was 38, and she's fine. She's now in her late 50s. And her attitude has always been, it can happen to anyone. And so all the way home, I was repeating to myself as a sort of mantra, why not me? Why not me? And it'll be okay. And again, I've known quite a few people who've had some rather grim diagnoses and are now living full and healthy lives. So I kept that thought very much in mind as well.
That's an interesting way of coping, in a way, because a lot of people think the opposite, which is why me? It's like a prelude to feeling injustice at the diagnosis, or even angry about it.
But it's random. It doesn't discriminate. It doesn't matter how old you are, how you've lived your life. You can live like a saint, or you can, true. I met people in hospital who had very, very similar diagnoses to me, but unlike me, they'd had children, they'd got family history. I haven't got either of those. There's so many different scenarios, and I think really, it sounds grim, but yes, we all walk within that shadow, don't we? And I think, if it happens, actually in my case, my ex-husband, who I'm amicably divorced from, he had a throat cancer diagnosis in 2002, and he's absolutely fine. He's living a very happy life in Greece. And he was very brave, very strong, very stoical throughout, and I think that helped me, because I remember being with him when he was given his bad news, and the consultant, the ENT specialist, actually said to him, your world doesn't stop here. And although that wasn't said to me at the Glenfield, the message was pretty much the shocking part of the actual receiving the news was when the nurse said, well, we can do something with this, but you're looking at surgery. And I remember saying, oh God, nothing too radical, I hope, and I'm going on holiday in September, and I suddenly did think, but I came to terms with the fact that surgery was going to be the only option quite quickly. And within 3 weeks of the diagnosis, I'd got it into my head that I was looking at a full mastectomy, because although it's DCIS and it's precancerous, it was multifocal. And so really I would have been quite deformed, I suppose the word is. A lumpectomy would not have done the job, and then I would have had the worry of whether the cancer was going to return. So,
and was that a decision that you came to, or did they really advise you there?
They advised me, but it made sense. And I think once I'd received all the options, I was given a lot of literature to look at, and had very good support from the breast care nurses and the consultants. Had a lot of good advice. And it did help me make that decision.
Yeah. Let's talk about the surgery then. So you were facing surgery at that point, and you thought it was the best thing, but it doesn't necessarily make it easy to go through that. And obviously there's the impact upon you and your relationship. There's a lot of things to consider there.
There are. I know before we made the decision, I had a sentinel node biopsy the week before, just to make sure, because there was some concern that it may have gone into my under my arm, lymph nodes, which it hadn't, thank goodness. But then I was. The staff decided I was a good candidate for an LD flap. And even that, there were decisions to make within that, even though I'd chosen the type of reconstruction I was going to have, and I was going to have it all in one go, because I didn't need any adjuvant therapies. I wasn't looking at chemo or radiotherapy, because the sentinel node biopsy results had come back as clear, which was a huge relief. I think that was the scariest part of the whole thing, waiting for those results. Anyway, when we went to the Glenfield, we were both, it was actually done very nicely. We were taken into a little side room with like a little lounge area with cups of tea, and one of the nurses showed us photographs of patients who'd had LD flap reconstruction, and also let us choose between the fixed implant and the tissue expander implant. Now at that stage I was sort of advised, and I preferred the fixed implant. It seemed to give a more natural appearance, and although it was going to be quite a long operation in one go, I thought, no, we'll go for that. So I had, diagnosis was the 28th of March, and I had my surgery on the 3rd of May. So there was a lot of decisions to be made within a very short period of time, and there was a bank holiday and the royal wedding in between. So, anyway, the operation was okay, although I did have a bleed and had to go back into surgery, but I was okay. But unfortunately, after about 3 weeks, I had a seroma build-up. I had a lot of problem with seroma, the fluid in my back, which had to be drained, which is a painless procedure. It's a bit of a hassle having to keep going to the Glenfield, but it doesn't hurt. I had quite a lot of fluid build-up at the front of my new breast, and the wound wasn't healing properly. And one day it sort of burst, which sounds horrendous. Again, painless, but a bit shocking. Phoned the ward, they said, come in immediately, and the outcome was I had to go back in the next day, because my surgeon, Miss Shakui, actually said, oh, I can see your implant. So she had to take it out, and I've had a tissue expander instead, which I've got now, and it's fine. I think I would have preferred to have kept the fixed one, but you can't really tell. It's okay.
Were there any other complications or issues after the surgery?
After the surgery, no. I might never caused any problem at all. A little bit of pain with the sentinel node biopsy, but I'm sure a lot of patients would say the same thing. It's just quite sensitive underneath your arm, and that, although that seems to be the minor procedure, the actual mastectomy and reconstruction, there's discomfort, and yes, you have to sleep on your back for 6 weeks, and you have to obviously manage your drains, but really it's amazing how quickly you return to normal. And I would definitely recommend do your physio, because you can end up with a frozen shoulder if you don't keep up with those, but keep that arm moving.
You were offered physio?
Oh yes.
Was it the advice to do it, to take home the
It was advice
techniques?
to take home. There's a disc, a DVD and some paperwork, but if you were having problems you could be referred for further physio, but actually it was quite straightforward.
And it made a difference to you?
Yes, it did, and I went swimming as soon as I was able to. That made a huge difference as well. Did have my main problem was the fact that the wound with the original implant, it just wouldn't heal, so I had to keep going back, sometimes twice a week, to have it dressed, and a horrible scab that looked like a huge beetle, and the nurses kept saying it'll fall off, and it didn't. And when it did, that's when the seroma fluid came out. But actually, again, it was a hiccup, but this happens, and I was warned of that, but I'm still very happy with the outcome. And the fixed implant, the expander surgery was quite a quick, uneventful procedure, and that was absolutely fine. The only problem was, because the expander was slightly smaller, even though obviously it's filled with saline, and over time, my good breast, my left breast, was a lot bigger, so I was asymmetrical, and I was self-conscious about that. It couldn't tell in clothes, but I knew, and so with my consultant we came to the decision that it would be sensible and in my best interests, emotionally as well as physically, to undergo a reduction and uplift on the left side, which I did in June 2012. That actually, I think I underestimated. That was quite a long procedure, but at the same time I had a nipple created on my reconstructed breast, so I'd always planned to do that anyway, but they did it in one go. But the actual uplift and reduction was very painful after. I think I thought it would be quite sort of a bit of a walk in the park, but it really wasn't. It was very sore. But I'm very happy with the results. See, that's quite a few months on now, and I'm at the final stage of this whole journey now. I've got one nipple tattoo appointment left at the Royal Infirmary at the end of this month. So yeah, I'm nearly there.
Now that's not something, the nipple tattoo is not something everybody's offered. And in some countries they're pioneering nipple conservation as well, where they preserve the nipple but remove the breast and then reattach the original nipple. So it is an important area.
It is.
What was your feeling about the cosmetic result as a whole and how things have turned out?
I'm very happy, really, and I always liked my breasts. I always thought they were an asset. I wasn't somebody who wasn't bothered about them. I was thought, well, yeah, I was in the queue for those. So they were okay. So yeah, I'd always, when I'd heard about friends of friends having to go through mastectomies, I'd always thought, oh God, I couldn't do that. But actually, the thing is, when it's have this or potentially shorten your life, then you get on with it. That was very much my view, and helped by the fact that there have been so many wonderful advances in breast surgery in recent years. Even talking to people who went through it all 20 years ago, it's really come on in leaps and bounds, and excellent care. I can't praise the Glenfield unit enough. I thought they were absolutely brilliant, and the staff on Ward 23A, the levels of care were just second to none. And
that's good.
So yes, I feel that my experience, traumatic as it is, I have been able to move on, partly again because I am pleased with the cosmetic results. I go swimming. Now at the point, because I've got a nipple tattoo, but I don't go and hide in the private cubicles. I can quickly get dressed and think, well, I wouldn't flaunt it, but I'm not paranoid about it, which could have been. And friends who've seen the end result say, wow, you know, you can hardly tell, it looks great. And so, yeah, because I'm 51 now, so I'm still reasonably young. And but again, it's not about age, it's about how you view yourself, and it's a very, very personal decision. I would certainly say in my case it's worked well, and I know a lot of other people who've been very happy with their reconstruction, but if you choose not to, or choose to have it at a later date, then that's also absolutely fine. I think sometimes people can be a bit judgmental about it, and I know I encountered in hospital somebody who was younger than me actually saying, oh, I wouldn't put myself through reconstruction, I'm just having the mastectomy. I'm feeling a bit hurt by that, and actually saying, well, no, it's my body and my decision, and you do what you want to do, and I'll do. And so,
yeah, I think that's a good advice for people watching, that they should make their own decision. But people also need the information to be able to make a decision, and sometimes people don't know the options that are available.
No,
but obviously watching this will help.
I do hope so, and there is a lot of information. I would also recommend people have a look at the Breast Cancer Care website. It's absolutely brilliant. Also, Macmillan's good, Cancer Research UK, and again, the Glenfield does. I was given a number of a lady who'd had a reconstruction. In the end, I didn't ring her because things happened so quickly, and I felt that I was able to get the information I needed. But you know, the service is there. Also in hospital, it's amazing. It's again, you know, you're all in the same boat. There's a bit of Dunkirk spirit, and you do end up talking to other patients about your experiences, and you do bond with people. And I've kept in touch with 2 fellow patients who slightly different experiences than myself, but you know, it's been helpful, particularly as one of them, her situation was again DCIS, and she's had the nipple reconstruction, and she's about 3 months ahead of me, so we've been able to exchange notes, which is...
Did you meet by chance, or was there an introduction?
She had her LD flap surgery 2 days after me, but unfortunately this is the only downside, and I don't know, this may have changed now, but the Ward 23A closed at the weekends, so we were sent to the orthopaedic ward, which... No, mixed ward, not good. But the 4 of us were together in the same bay, and we've kept in 3 of the 4. One was also very nice, but I think she just wanted to not have any memories of the hospital, so that's fine. So it was during that, in the face of adversity, that was something good that came until we were repatriated on Monday morning back to our own ward. But because I had quite a bad bleed in my main surgery, I was kept in for a week, and I didn't have to go home with my drains. And I think that was something that was worrying me, but I'm sure if people do, you get lots of information on how to cope with that.
Now, this idea of having contact with other patients, it's an idea we're trying to develop. You know, we generally call it peer support. But do you think that should be organised, you know, like the NHS providing links with previous patients who've been through it?
Yeah, I think it should be an option. I think often people, when it depends what stage you're at. If you're all going through something at the same time, you've all sort of been diagnosed within the same month, I think you naturally gravitate towards those people. I think what can be quite annoying when you're first diagnosed is you hear about everybody's aunties, cousins, nephews, and also you get so many ridiculous comments, and I know people are trying to be helpful, but somebody who went through this 40 years ago is not going to have the same options, and I think that can be actually quite irritating in your early stages when you're coming to terms with your diagnosis. But I think, yes, offering that service to someone who has been through it in very recent times, and perhaps is a similar profile, similar age, particularly if it's somebody, say, who's got the BRCA gene and they want to be in touch with somebody else who has it, then I can see that makes sense.
Now, the same issues might apply to group support or to online support, you know,
yes.
like the basically kind of chat room support type things, which you can get nowadays.
Yes.
Did you ever try any of those?
I had some, yes, with the breast cancer care website. I did private message people, and I had some messages returned, and also online, we posted, and I found that really useful. And of course, although you can't say where you're posting from or name your consultants, which is all right, you do find out as well.
They advise those rules.
They do advise those rules, which is fair enough. And you also realise how good our treatment is here in Leicester as well, because not everybody's experienced. It might be a bit of a postcode lottery, and I think we are lucky that we have such a good team and such excellent support. So yes, I think being given the option, if some people do tend to not want to talk to others, or they might not quite be ready for that. And sometimes in a hospital or when you're in the waiting room at the Glenfield unit, you naturally have a conversation with someone. Again, it's a personal thing, and I think it should be added to the list of services.
Are there any gaps or areas for development that you think could be useful for people who are going through this now?
No, because my last experience by proxy was when my ex-husband was diagnosed. I found at that time there was very little information or concern for the families and partners. That has changed tremendously, and I know the leaflets we were given, there was a lot about how you tell your children. In our case, of course, because it's such because of the area of the body with the breast as well, there was a lot of information on image, on physical relationships, sex life. A lot of that is addressed now, and I think years ago that wasn't part of the equation.
That's kind of more out in the open now.
It is, definitely.
Information out there. You can, if you're somebody who likes to, collect information and read information, it's there. It's
there, and it's in many formats as well. You can have it as a leaflet, or you can look on the internet and be put in touch with people in similar situations. So yes, I think that levels of awareness are quite high now, and I loved the fact that before my op I was taken to this little room and shown in fact we both were, myself and John, and shown the photographs of other people, and now they're looking at photos of me not with my head obviously, and that was very, very encouraging. And also my consultant, she hadn't actually undertaken my SMB, that was somebody else, but because it was decided that she was the best person to do the LD flap in my case, and she came along and met me, and we chatted about it weeks before the op. So I went in there on that May the 3rd morning feeling that I knew what was going to happen to me. I knew as far as possible, I knew what to expect. And the wonderful, wonderful thing is to wake up with, if you've had a mastectomy, to wake up with something there. In my case, I think if I'd woken up and there'd just been a scar, I would have not come through this the way I have. I think that would have been quite devastating.
Well, in a way, when you wake up and it's a scar, there's a temptation to focus on the loss.
Yes.
I mean, you've got a bad experience of the diagnosis and the fear of what's going to happen in the future, and then you've got to have the surgery as well. And the surgery, even if it's a good result, medically, you still may have a cosmetic result which you're not entirely comfortable with.
That's true.
And then you've got that process after the surgery, the adjustment process, to try to get back to as near normal as possible. That's very true.
And I had a sort of taste of that when I had to have the fixed implant removed and the tissue expander inserted instead, because immediately after surgery it wasn't pumped up with a saline, so it was quite flat, and there was quite a big, probably 2 or 3 cup sizes different, and to wake up and was upsetting. And for a little while I did have one of the softy prosthetic things, and I remember thinking, God, if I'd had to live with this, I would have been very upset. I would have found it very difficult to move on. But I knew that was a temporary thing until I went back to clinic and had some more saline and fine. And certainly since that, I'm very, very glad that I had the reduction on the other side as well. I think now it's a complete job. So yeah, that was that option was very important, and I didn't have to ask for anything. Everything that I've had done has been offered to me, or certainly the options available have been explained to me. But I didn't feel at any stage that I was having to sort of fight for anything. It was all there, and which is lovely, because in this day and age, you know, there are such pressures on resources, and
well, there's no doubt that's ideal, but I'm just thinking now from the perspective of another, you know, person watching this who may not have been so fortunate regarding the steps flowing kind of naturally and having a result that they were really happy with. You know, sometimes the options either are not available or not appropriate for that stage or whatever.
Yes.
And those the result isn't really what the person was wanting, and sometimes people do have to fight for getting the treatment up to, you know, up to scratch, basically.
They do.
Do you feel you could have done that if you had to? Or I know it's difficult to put yourself in those shoes.
Yes, I do. I mean, in other areas I've had to, certainly with my orthopaedic problems, I've had to really, you know, make my point. So yes, I think I would know how to do it, but it was very refreshing to find that I didn't have to, and also to talk to people from other parts of the country who their experiences had not been as good, and it did make me really value what we have here. Because
I guess from a viewer's point of view, even if things haven't gone as smoothly as your situation, yours can be held up as an example of how things can go with good care.
Exactly, and mine wasn't without hiccups, you know, because obviously in an ideal world the fixed implant would have worked. I mean, actually the main mastectomy and reconstruction op, I did bleed quite a lot. It took me quite a long time to recover, because it was at one point I was going to have a blood transfusion. In fact, my partner actually came to recovery. You know, it was all a bit worrying, and so I ended up with probably having something like 4 general anaesthetics in a year. So it was all quite trauma. But even against that, I do feel that I've had good care. And it was, again, I think I was glad that I was told about seromas. I remember being given a leaflet thinking, oh, I don't even know what that is, I'm not going to worry about it. But actually that came in useful when I needed the clinic. And although there were certain set days where I deal with certain problems, I found that I could ring the ward and speak to one of the breast care nurses whenever I wanted. So that was very useful as well. There was always that reassurance there. And that morning when there was a problem with the fixed implant and I did have this leakage, the fact I could ring the ward, speak to a doctor and be actually seen within a couple of hours was marvellous. There was no sort of, oh, wait 2 days. So yeah, there is that level of care there. Yeah, I know probably in some cases it doesn't always go to, and also you have to manage your own expectations. You do have to be aware that this isn't your natural breast. It's never going to look like it did before. But it's a pretty good job of, you know, it's considering, you know, you think what happened years ago with, you know, people having to rely on cotton wool, and really, you know, you cannot tell. And it's, in my case, I feel able to lead a normal, active life. I don't really have issues, any self-esteem issues. And go swimming. I'm not worrying about if I'd had, I mean, I was lucky enough to be able to have it all done in one go, but I haven't got the worry of having a prosthetic breast and thinking, oh, is it going to fall out of the swimming costume? Am I going to be chasing it? Everything's, and I'm really not bothered. I've got a slight scar on my back, and you know, to me, that's my battle scar. I'm actually quite proud of it. So yes, I think that my main advice would be to people, that I still think about this, if there are any changes at all, do have them checked out. I was reluctant because I suppose I'd had the warning sign with the very, very minuscule amount of bleeding in the right nipple a couple of years before, which again I was checked out and was okay. But the fact that there was, to me, and it was, as my GP didn't notice particularly, but to me they didn't feel the same, and it didn't matter what I told myself. I tried to reassure myself and thought, well, yeah, perimenopausal, a lot of your friends going through the same thing. And I made one appointment with the GP and actually cancelled it because I got something better to do that week. And then I left it for another fortnight. So I probably left it a good, between noticing the change and going, probably 3 or 4 months. Now, because DCIS grows quite slowly, it didn't matter. But when I actually had my results back, I had got DCIS with microinvasion. I haven't had to have any other treatments, but my consultant said, we got it just in time. So I would definitely say, I know it's scary and the chances are it's only a cyst, but go and have it checked out. Certainly would. And also, talk about, I know it's a shock when you're first diagnosed, but ask about any reconstruction, about the different types, because I know they do them, well, most of them in Leicester anyway. So.
So Louisa, let me ask you about how this diagnosis and this subsequent events impacted upon your whole life. I mean, particularly personal life, but work as well. I mean, what was the situation with work at the time?
Work was very difficult because I'm a freelance PR consultant. I was 8 years into self-employment, got a good client base. And bear in mind, I suppose recession had hit as well, so things were getting a little bit tougher. But I've still, got a lucrative business. And I was in that dilemma, who to tell and how much I should tell and how long I was going to need off work. And I found in many cases, most clients were very, very supportive. In some cases, I didn't actually tell them what was wrong. I just had serious illness and left it at that. But what I did find extremely useful, Macmillan has a section on the website about self-employment and what to do in terms of telling clients or customers, or because it is different than being an employee. Obviously there are structures in place for that, but with self-employment you're sort of out there on your own and you think, well, I don't want to faze anyone, I don't want people to think that I'll never be well again and I'm not up to the job. In fact, there was one of the worst times when I was waiting for the results of my sentinel node biopsy, which was this sort of April time. I actually spent all day Sunday before that Monday writing some very boring copy for some sort of engineering brochure, and it kept me focused. In fact, it was my salvation. Otherwise, I'd have spent the whole day being worried sick about even more worried about the results the following day. So in a way, I did throw myself into my work where possible. I think I underestimated the length of time I would need to recover, because I was in hospital a week and it was probably another 3 or 4 weeks before I was really able to do much. I think because I'd lost a lot of blood, I was actually quite anemic, and I was a bit tired and wan and achy. But the clients, because a lot of them were on retainer, they were very understanding, and that was okay. But it was later on then, it was when I was getting better that then, it sort of impacted more. And it has been a struggle to keep going.
And what's the situation now with work?
Gradually building it up again. But yeah, I have had some orthopaedic problems as well, which have impacted very badly on that, because only less than 6 months after my breast operation I had to have hip revision surgery, and I was out of the game for 3 months after that. So, and then I had my reduction up, which had to be delayed because of the hip revision. So it's been a fun 2 years, really.
You had a lot of health issues.
Yeah. But yes, I'm very well. I'm generally very well. Put on a bit of weight. That's annoyed me a bit, but then I think that's my age. So I have to live with that. But
now, sometimes when somebody has a really serious diagnosis and they come through it, their view of the world or their work-life balance or personal life can change a little bit?
Yes, it has a bit, yeah. And I did have some critical illness cover. And because I didn't have invasive cancer, I didn't get a full payout, but I did get a percentage of it. And although we used some of it just to day-to-day living, I did promise myself that we would go on holiday. We'd have a decent holiday in September once the reduction surgery was, over. And I did. I thought, so I do now, even at the moment, although I've put in a lot of effort into rebuilding, trying to get some more clients and do some more work, I'm always aware as well that if a chance for some fun comes along, I'm going to take it. I really am. I think, well, things could have been so much worse. So, and I go swimming at least 3 times a week, and I make that part of my week because that is so important to my general well-being. So yes, it does alter the way that you feel about your life, about your relationships. It's an old cliche, and I'm sure the patients would agree with this. You do find out who your friends are. I've had friends who I thought were friends for life who've been absolutely useless. I've had other people who were merely acquaintances before who have been absolutely rock solid. So I'm also in a good relationship. He's been very, it's been terrifying for him, but he's been marvellous. And there doesn't seem to be any, we've talked about it, and he doesn't seem to have any issues with my new appearance. He thinks it's a good result. Yeah, and he's just glad I'm well. So.
Well, that's good to hear. That's good to hear. And what are the long-term plans for you now? What do you see for the future for yourself?
Do you know, it's weird. I don't make long-term plans anymore. I just think, it's that whole thing about you can make plans and then life happens. Mm-hmm. I have an idea. I plan sort of treats, but I don't. I mean, at some point in the future, my only long-term plan is to move to Derbyshire at some point, which is where John's from, but that's in the next few years. And to have a dog, that is a big part of my plan. But in terms of the usual interview questions, where do you see yourself in 5 years' time? I just think, just live each day, stay well, and that's really how I see it.
And are you enjoying days now? With work building up again?
I am, and it is a good thing. And I'm not. I went through a stage initially after diagnosis of being quite angry and quite short with people who didn't seem to understand the whole change that this diagnosis brings. And I think I'm probably a bit kinder now to people about it. And also through this whole 2 years, I've had two bereavements as well. And so I've had to be there for both people. Well, one of the people is very close to me, and it's her son. And so we do compare notes in the sense of how we now view life. And I think in my terms, mine's much more manageable than her situation. But there are parallels, and we do discuss that, about how we don't, as the Americans say, sweat the small stuff. We do think, let's just concentrate on the things that make us happy and the people that matter to us, and that's really all that counts.
Yeah, I think that's a nice attitude in a way, and one that a lot of people would benefit from if they could use it.
Yeah.
So,
and I do feel lucky. I feel lucky that if this had to happen to me, it's happened at a point in my life where I'm in a good relationship. If it happened a few years ago when I was on my own, or when I've been in not so good relationships, how would I have coped then? I would have had a very different view of what this illness has done to me, and in this. So, yeah, if it ever had to happen, it's happened at the right time. So,
I mean, generally people who are on their own, they're relying more on friends and other support that's out there, and sometimes more on those professional links and resources that you mentioned earlier.
I am a sort of person who and this is, John always said, is you buy into it completely. My mum's a nurse, and she's always had this idea that if you have faith in your team, that's a good start. And she's had quite a lot of health problems in her lifetime. And I did that. I was proved right to do so, fortunately. And I think that's seen me through it. You know, sort of immerse myself in the process. Big problem, and I think you'll find this, a lot of patients find this, is when you're getting better and your appointments are becoming further apart, and you can feel a bit adrift and a bit lost.
Oh, definitely.
Yeah.
That's
and
a big
you can
factor.
almost,
Particularly when the acute treatment's finished and you're just going into routine, i.e. irregular monitoring.
Yes, that was...
It can feel quite nerve-wracking.
And the day I was actually discharged from the breast care clinic, which was, when was it, last year? Yeah, last year sometime. It was last summer. I should have been elated, and I wasn't. I felt actually quite frightened, and I remember saying, if I find anything else, do I have to go back through my GP? And they said, well, yeah, it's the normal channel, but you can always ring up. And so I haven't got my follow-up appointment till my next mammogram's not till November this year. But even so, it was just not going back and seeing those same reassuring faces, and almost because they know you by name, it starts a bit Munchausen, you start to feel a bit special. And then suddenly to be cut adrift from that and think, right, I've got to get on with it now. Nobody else knows. It's just, that's the way it is.
I mean, in general, it's a good sign to be in that phase where they don't have to follow you
it's great, yeah.
With so much scrutiny. But having said that, I think we should have a more gentle transition and some services which I think are available in the Scandinavian countries. They call it rehabilitation oncology, where they're trying to get you back to, normal life.
Yeah, I would recommend that. In fact, having, when it was the penultimate appointment and I'd gone to, there was a little bit of problem with the nipple, the new nipple wouldn't heal properly. Well, it was all right, had to have some new dressings on it. And I remember going back, and I was a bit down that day, and normally I've been fairly upbeat, and one of the nurses saying, I think we need to refer you to the Royal, to the psychology side of it. And I was quite surprised. I'm coping. But then I thought, no, that's a good thing. And that has helped, definitely. It's helped me a lot, because I've been able to sort it out in my head where I've been and where I've got to. And yeah, I think that's a really marvellous service, and I very much hope, for the sake of other patients, that it continues. I think it is healing the mind is just as important.
Definitely. So I wish you all the best for the future, and I know you've been through a lot in actually quite a short space of time, and like you said, not everything's gone perfectly, but the main important things have gone well, I think.
They have, yes.
And it's left you right now in a relatively good position. You're enjoying life, and you're back to work's going quite well, the relationship's going well by all accounts.
Yes, it is. And I do tend to think, I suppose I think of myself as a survivor, but I don't tend to think of myself as a cancer patient anymore, and that I got over that quite quickly.
Yeah, I mean, that's really the ultimate sign of success. If you can think of yourself as, well, I had that diagnosis and I was treated and it's part of my life, but right now I've moved on from it.
Yeah.
I mean, that's a really positive move. Not everyone can do that.
No, I do feel very fortunate that I've been able to do that, but yeah, that's where I'm at. So thank you very much.